61 is coming from different institutions, but
I understand that's not the point, ma'am.
Yes, I agree with you that it's unacceptable, even if it's one or two of those cases. Hence, we're making up measure, we're ensuring that there are measures in place that we're dealing with this situation. We have installed CCTV cameras on strategic locations in the hospitals, especially where there are wards, where there are mental health care users. The security has been tightened because you will find even in every area there is security at the door so that they can assist them if they are being attacked immediately. But again, we have the process of psychological and emotional support that is being done to the staff. And I think it's working, that one, because as the earlier person, the spokesperson from our office was saying, there are trainings that are being done. So those are continuous now, because we have even a department that is responsible for that, which is the occupational health and safety officials that are responsible for that in our department and in our hospitals. And again, we advise staff to always follow standard operating measures when they are dealing with this type of patients. But it's something that we're not happy about it.
Yeah.
We can't celebrate the attacks from the staff that is assisting them, because the staff is assisting them. Hence, we always believe that those are the people that must know they are there to help them, not to attack them.
Yeah. All right. I'm also concerned about the fact that some of these incidents, and I would assume even a majority of these incidents, are women. And we're talking about perhaps women who are working late at night, having to assist, in some instances, even male patients. You're talking about measures that have been put in place. You're talking about CCTV cameras, and I imagine that there will be security guards watching that CCTV footage. But, it takes some time from possibly where this particular security guard is stationed to get to the health worker and to be able to assist. Is there no thought process in terms of perhaps getting workers to work maybe in pairs? And then we also have to deal with the issue of perhaps being short-staffed. I mean, there's a lot of issues, I suppose, that you're dealing with. Let's talk about, what you have pinpointed as some of the problems, because I would assume if you're putting measures in place, you've pinpointed a number of issues.
The security guards are not far. They're just right at the door of every ward, where there are patients that we know that they are disturbed mentally. So we're not putting them far away from them. They are close by, and you don't find one nurse in those wards. At least there are two nurses that will be in the ward if we're saying we're understaffed. So it's unlike we're not taking care of that, because we know that if the nurse is one, definitely they can't cope with the pressure of those guys. And I've seen them, even myself. They're a bit violent, some of them. Some of them are young, they're aggressive. So definitely you can't have one woman or one young lady that is attending to them. We definitely need more of that. And again, we're working very closely. We have a memorandum with SABC that we definitely make sure that, again, SABC is assisting us in cases where they are wild. Because I remember at some stage I was called, there was one case in West Rand where this patient was very wild, but already the SABC officials were there to assist in terms of that and make sure that at least they normalize the environment. And the patient was sedated and he was able to sleep. So at least we do have those processes that are there, and we're trying to assist and mitigate immediately so that we don't wait until it's late.
Some of the suggestions, that have been raised, I think I heard a union member talking about suggesting that patients be put in places and being moved to institutions that are well equipped to house them. And, when you're talking about moving mentally ill patients, one can't help but to think about what happened. We think about the Life Esidimeni crisis and what happened in that regard. Is that, is that a suggestion that you're taking into consideration, but also on the back of, the understanding that this is what took place in South Africa?
No, we have specific wards in the same hospital. We're not moving them away. There are certain wards, but it must be a safe ward. We all know that it can be a ward that is not safe for them. So we have those safe wards that are protected, that they are protective. They protect them. And if you can just go and visit one of our institutions, we can take you. You can see where they are. In fact, it's not an area that it's far away from people where they cannot be attended to. because there need to be a psychologist in place, doctors in place, and nurses in place. So we're creating that safe environment. And in some of these incidents, it happens like, hospitals, like your Vescopis, it's an hospital that is designed for them. So we know that they are there and they are being attended to in that hospital.
Yeah, and I understand.
Where we have seen even the number, because we've seen the number, they differ. In other hospitals, there's not a higher number, I'm sure you've seen in those incidents, but in a number where there are many of them, like we'll find the area, it's 44 bedded maybe, or it's 400 bedded.
Yeah.
So it differs in terms of the areas where they are.
Yeah, and I understand it's not, we can't just put the blame on mentally ill patients. I did see that you, in fact, were responding to questions at the Gauteng Provincial Legislature on these incidents of attacks at the facilities. And you yourself mentioned that there's also situations where you find there's angry relatives who are, attacking healthcare workers, even in some instances, patients who are linked to criminal activities. Let's talk to that, MEC.
Yes, there are some cases where you find that it's just relatives that they get in there and they'll budge and they'll scream and say, my mother or my sister has not been attended. And then it takes the anger to the nurses, poor nurses. And that's another thing that they'll be victimized, even by some of us when they visit the institutions. And we always say, please, when you arrive at the hospital, if you can see that there's something that is wrong, don't just scream at them. Go to the matron, so that you can report the cases and the incident. Then we are able to attend to that. So those are the incidents that we get sometimes, but those ones are not many. It's just one or two cases that we'll find in an institution, and we try to attend to those again. That's why sometimes I always say to the nurses, when my child is sick, even myself, I become more sick than the child. And that's the environment that you find to those parents that come there and drop their children, or those children that drop their mothers or fathers. They will raise those incidents that our mother or my parent was not attended to at the hospital, but we try to normalize and counsel the person, because that's the first thing that we must do even ourselves. We must counsel you so that you can understand the environment where we operate, and then we can deal with the situation after that. So those are the other angry incidents that we get, and they are quite often those ones.
Yeah.
I know even myself, sometimes I will get a call midnight, the person is very angry that I have been there and I was not attended. I've been here for more than 4 hours. Those are the incidents that we get, and immediately we intervene. But now what we are doing again, we are coming up with a dashboard that is going to assist us to monitor all the hospitals and all the clinics in the province, so that even when I press the button, I know that this is the incident that has happened in this hospital, and then we're able to gather the information immediately and attend to it. Because that's what we have realized, that having these phone calls just one by one, it's not going to help us. But now we need to be more creative in terms of dealing with these problems.
Yeah. While we're having this conversation, I just thought about the fact that there would also be trainee healthcare workers, young healthcare professionals who are sort of coming into the healthcare industry. And I wonder, are they properly prepared, for what's to come? I'm not saying I'm not worried about those who've been in the healthcare industry for a long time. And I would imagine with some of them, they've sort of gotten used to some of these attacks that they are, subjected to. But, if you're talking about a trainee or a young healthcare professional, I would imagine that in some instances even puts them off, being part of this industry.
Trainees always don't work alone. They work with the senior ones. So the senior staff members that are in the institution are the ones who will always mentor them. And we're encouraging that mentorship programs to them so that they're able to handle the pressure and the situation at the hospitals. Because you imagine when you take an intern to Para and you expect that person in a 52-bedded ward that she can't be alone there. Definitely there must be the seniors that are assisting them. So you can see when you go to the bank, I always say to them, let's operate like a bank. Because at the bank, when you get there, there's somebody that will take you through for a week or 2 weeks until you understand the processes and the procedures. And another call that we want to do now is the senior old nurses that must come and assist our own in the hospitals, so that when they have it, at least 1 or 2 hours, but we're still working in that process, that those that are available that can assist us, especially to train the young ones, because I always say to them, we still need your service. Those that are leaving the system now, that don't go and then forget where you come from. Come back again to assist us, especially to what we are saying, Flo, of the young ones that comes there vulnerable, 25-year-old, 22-year-old that are fresh from school. They need that assistance, definitely. So we are encouraging that it must happen in our institutions. And I think they are doing well, the senior nurses that are there, including the senior doctors, because it's not only senior nurses and doctors, including the allied, those that are working there, make them feel at home. That's the language that I always use when they arrive at the hospital.